India's healthcare system is one of the largest in the world, yet the very people who make it function, our doctors, nurses, and support staff, are increasingly subjected to violence and abuse. From verbal insults to physical assaults. Take the case of Dr. Sudhir Kumar in 2019. He was brutally beaten in the Indian state of Uttar Pradesh after a patient's relative died during treatment. The family accused the doctor of negligence and took matters into their own hands, physically attacking him. This is just one example of a disturbing trend that's becoming more and more frequent. Imagine being a doctor, working 18-hour shifts trying to save lives, but instead of gratitude, you're met with accusations, violence, and even threats. And in some cases, the gender of the healthcare worker only amplifies the abuse. Female doctors face not only the pressure from their jobs, but also the added burden of sexism. Take the example of Dr. Nisha Priya Bhatia, a resident doctor in a government hospital in Delhi, who was verbally harassed and even physically threatened during her shifts. Patients' relatives sometimes demand preferential treatment, and when they don't receive it, they lash out, especially if the doctor is a woman. Many female healthcare workers report feeling belittled, dismissed, or even sexually harassed by patients or colleagues. Sadly, Dr. Nisha's story is not unique. Many female healthcare workers experience sexual harassment or are dismissed as incompetent simply because of their gender. They face harassment from patients' families, and even colleagues, making their already difficult jobs even more burdensome.
But it's not just the doctors currently in practice who are affected. The next generation of doctors are watching. Aspiring medical professionals are often deterred by the harsh reality of what they could face. The fear of violence, harassment, or the constant risk of abuse makes many question whether they even want to pursue this career. The problem has reached epidemic proportions, as in 2019, the Indian Medical Association, the IMA, reported that over 75% of healthcare workers had experienced some form of violence or abuse during their careers. And it's not just a few bad cases. This is happening across the country, in urban hospitals and rural clinics alike. Moreover, the toll on healthcare workers isn't just physical. The mental and emotional effects of this abuse are profound. Healthcare workers are increasingly reporting symptoms of burnout, depression, and post-traumatic stress disorder. It's not just the immediate pain of attack, it's the long-lasting psychological damage. The fear and the constant anxiety of whether today will be the day they're attacked or insulted, it eats away at a person's mental health. The stress of dealing with these situations affects not only their ability to provide care, but also their personal lives. In addition, healthcare professionals often feel isolated as they often don't have the support they need to process these traumatic experiences. There are laws in place to protect healthcare workers, but are they enough? In 2019, India introduced the Healthcare Service Personnel in Clinic Establishments, the Prevention of Violence and Damage to Property Bill. This law aims to make violence against healthcare workers a criminal offense, with severe penalties for offenders, but enforcement remains a challenge. While the law is a step in the right direction, its effectiveness is still questionable. In many cases, especially in India, the legal process is slow, and the protection promised by these laws don't always materialize when healthcare workers need it the most. This leaves many in the field feeling vulnerable and unsupported. We must foster a culture of respect, understanding, and support for those who save lives. Laws need to be enforced, and mental health support must be readily available for those who suffer from the trauma of abuse. It's time we stand together, patients, healthcare providers, and the community. Together, we can create an environment where violence and abuse are no longer tolerated. Only then can we ensure that doctors, nurses, and other healthcare workers can care for us without fear. Let's raise our voices. Let's stand by our healthcare workers, Because when they suffer, we all suffer. But when they're safe and supported, everyone benefits.